The accusation that you don't look sick is something millions of people living with an invisible illness, as it's called, have to face every day. You know, people say, oh, you look fine, but actually they're going through hell. Well, Dr Hilary and Dr Amir join me now. Amir, what are we talking about? You know, when we say someone's got an invisible illness, what do we mean?
Yeah, morning. So an invisible illness is an illness or condition that is physical, mental or neurological, which isn't visible from the outside, but can seriously limit someone's activities, their senses, and their ability to do things during the day. Just the fact that it is invisible can lead to misunderstandings and judgments. There's 15 million people in the UK living with a chronic disease or illness, and many of them are invisible. So we're here today to educate people about what invisible illnesses are and how to tackle them and how to approach them.
No, I guess, and Hilary, I understand when it comes to mental illness, an awful lot of people put a brave face on, and they oftentimes don't look as though anything's wrong.
Anxiety is one of the commonest mental illnesses of all, with 300 million people globally suffering from some form of anxiety. But often you can't see it. Sometimes you can see it. Sometimes people have a visibly obvious panic attack, or they'll sweat, or they'll shake, they'll clench their fists, you know, they'll sweat, and that's obvious. But there are people with high-functioning anxiety where they can be high achievers, they can be highly organised, very successful, apparently socially outgoing and confident, but inside they're in turmoil. Inside they really suffer, they need reassurance, they worry about, you know, how they're perceived by other people. They find it difficult to say no. These are perfectionists, but they've got high-functioning anxiety. This is very common, but you won't see it from the outside.
That's the thing, isn't it?
And whilst they might be fine at work, when they go home, they're in bits, they're in pieces.
So
this is one example of a
yeah, we just
invisible
have
illness.
to be kinder because we never know what's going on in people's minds. We really don't, Amir. I guess depression is the same sort of thing. Sometimes you will be able to see it, but oftentimes people are trying desperately to hide it.
That's right. You know, lots of us may think we know what depression looks like, that those feelings of hopelessness, that joy being taken away, sometimes wishing that you weren't here. And some people will be affected by that really in a way where they can't get washed or dressed or out of bed in the morning or maintain a home and job. And that is fine. That is depression. But there are other types of depression as well, where people appear okay on the outside. They're able to go to work. They're able to maintain a family and home life as well. But inside, they're in a very dark place. And they often hide the parts of their lives that aren't doing well and show the bits that are doing well. So, for example, you might have a colleague at work who is excelling in their job, but on the weekend they're crying and they're unable to get out of bed because they're crippled with depression. Or there may be people on social media who are happy and smiling, but are feeling empty on the inside. Now, all types of depression deserve to be treated. Just because you've got one type doesn't mean that you don't need the treatment. So please do speak to a healthcare professional. You can have talking therapy, cognitive behavioural therapy, medication if that's something that will help. But do please come and speak to us.
No, absolutely, you need to. And, you know, there's a lot of physical complaints, illnesses, diseases that are hidden as well. Because people always try to get on with it, don't they?
They do. They put on a brave face. Fibromyalgia is another common example where people get a heightened sensation of pain. That their pain is intensified by messages that come from the body to the brain. They are misinterpreted by the brain, so what they feel is genuine pain.
Of course.
And other people can't see what they're going through. So often the pain will be focused on an area of the body with a muscle ache or a muscle pain, but there may be lots of other symptoms. There may be fatigue, there may be bladder problems, dry eyes, all sorts of things. So just because we can't see it doesn't mean to say that people aren't suffering. They are. Right. And of course, irritable bowel syndrome is another example. Irritable bowel syndrome, very common, 15% of the population, with cramps, bloating, wind, alternating constipation, diarrhea. And those people can't go out to social occasions because it's too difficult. So what you don't want to say to them is, come on, don't be a bore, come out, you know. Come out with us.
Pull yourself together.
If they can't find a loo within 10 minutes, it's miserable for them. So we need to understand how they're feeling.
Sure.
And also, those people who are suffering need to reach out to those people and say, I'm not actually 100% at the moment, but forgive me, I'd love to come if I can, but I can't at the moment because I'm just not 100%.
And I see in some of the papers today using a breakthrough on symptoms of things like IBS, Crohn's disease, which is an awful
inflammatory
thing.
bowel disease.
Inflammatory, right.
Which is different to IBS,
Right.
which is irritable bowel syndrome.
Okay.
Irritable bowel syndrome doesn't cause any physical damage to the gut.
Right.
There's no increased risk of cancer, for example.
Okay.
But inflammatory bowel disease, Crohn's disease, ulcerative colitis, they have discovered a gene which predisposes certain people, most people with these conditions, to those things. And what's really interesting is that in trials that they're doing, they think they can repurpose drugs which are already in existence to help those people and prevent some of the surgical interventions that may be necessary. But trials will take about 5 years before anything's available.
Right.
So it's exciting, but don't get too exciting.
Not quite yet, but work is being done, which is good to know. And Amir, something like, you know, chronic fatigue, we've seen the effects of long COVID, things like that, where people are just exhausted.
Yeah, chronic fatigue is certainly an invisible illness. It's also called myalgic encephalomyelitis. And it's a range of symptoms, the main one being extreme tiredness that doesn't go away with rest or treatment, and it's not explained by an underlying medical condition. We don't know the exact cause. It could be genetic, it could be after an infection like COVID, or it could be a problem with the immune system. All of those things play a factor. So does physical and emotional trauma. There are other symptoms with chronic fatigue syndrome as well. You can get dizzy, you can get muscle aches, you can get sore throats, glands, headaches, all sorts of things. And the key thing here is to be really understanding with these people who are suffering with this, because they often have to adapt their daily life around their symptoms when they're good and when they're bad. And just don't say the wrong thing. The right thing to say is, tell me about your condition, if that's something you're comfortable with, and sit and listen to them and say, thank you for telling me about it. Now I understand it better. Remember, judge a person by what they're telling you. Listen with your ears, not with what you can see with your eyes.
No, that's so important. And you, both of you, do that anyway in your job, because oftentimes people will come to you with one thing and then there's something else, or they're not telling you the whole story. And you're right, just give people the opportunity. You know, that's what it's about, Hilary, isn't it? Just give them the opportunity to tell you.
It's quite right. It's about listening and not assuming that we can tell a book by its cover. Sometimes we can't. Sometimes there's something going on inside. 60% of people with anxiety never, ever seek help because they're too embarrassed to, or they feel it's a sign of weakness. They need help, talk, listen, and then everyone's got that support and love.
Exactly. Thank you both very much. Thanks very much indeed.
Pleasure.
Yeah, we just need to be a wee bit kinder. I think that's the main thing.